Throughout human history, medicine has been a strange mix of brilliance and brutality. We tend to think of hospitals today as places of comfort care and precision. But for most of the past, going to a doctor meant something very different. It meant facing procedures that were crude, experimental, and often unimaginably painful. So painful, in fact, that people would put them off until the very last moment, hoping their bodies could heal on their own. But here's the remarkable part: people still did them. They still chose to go through the pain because the alternative was often worse. And in the process, these early treatments, however terrifying, pushed medicine forward. In this video, we're going to explore some of the most painful medical procedures ever performed. Not to shock for the sake of shock, but to understand how humans survived, adapted, and eventually transformed medicine into what we know today. This is the story of how pain shaped progress. Let's imagine something for a moment. You are lying on a wooden table. There is no anesthesia, no painkiller, no sterile tools, just a doctor holding a saw, and you are fully awake. It sounds like a nightmare, but for most of human history, this was simply what medicine looked like. In fact, if you lived before the mid-1800s, almost every medical procedure, from fixing a broken bone to removing a tooth, meant one thing: pain. Pain so intense that many people fainted. Some went into shock, and a few didn't survive the procedure at all. Today, we're going to look at some of the most painful medical procedures humans have ever experienced, why they existed, and how anyone survived them. Not to shock or horrify, but to understand how far medicine has come and how much people endured just to stay alive. Let's start at the beginning with one of the oldest surgical procedures in the world: trephination. Trephination is simple in concept. You cut or drill a hole into the skull. There are ancient skulls from Peru, Europe, Africa, and Asia, all with circular openings carved into them. Some are smooth around the edges, which means the person actually healed after the operation. Others show no healing at all. If you think drilling a hole in the skull hurts today, imagine experiencing it with stone tools, no anesthesia, and no understanding of the nervous system. The scalp is one of the most sensitive areas of the body, packed with nerves and blood vessels. So just getting through the skin would have been agonizing. Then comes scraping the bone, slowly thinning it layer by layer while the patient is fully conscious. So why did people do this? Many cultures believed trephination released evil spirits, treated seizures, or relieved pressure after head injuries. And while the explanation wasn't always scientifically accurate, the results sometimes were. In cases of head trauma, removing part of the skull actually can reduce dangerous pressure on the brain. So in a strange way, ancient surgeons stumbled into a treatment that occasionally worked. Trephination shows us something important: medicine in the past wasn't always foolish. It was often practical, logical, and based on observation. But it was carried out in a world where pain was unavoidable. Now let's move to a procedure that defined pre-modern medicine: amputation. Before anesthesia, amputation was the single most feared surgery a person could face. And yet it was surprisingly common. Wars, infections, farming accidents, and untreated injuries often left no other option. If a limb became gangrenous, you either removed it or you died. A typical amputation in the 1700s or early 1800s happened like this: the patient was held down by assistants. The surgeon, knowing every second mattered, worked as fast as humanly possible. First, he cut through the skin and muscle with one sweeping stroke of a large knife. Then he grabbed a bone saw and cut straight through the bone. After the limb came off, he cauterized the blood vessels with a red-hot metal iron. All of this happened while the patient was fully awake. Reports from the time described the pain as indescribable. Some patients screamed. Others went into shock and passed out. A few were said to stay eerily silent, overwhelmed by the pain. And yet speed saved lives. The best surgeons of the era were famous for finishing an amputation in under a minute. There are stories of surgeons removing a leg in less than 30 seconds. Because the longer the patient suffered, the more likely they were to die from blood loss, shock, or infection. It's difficult to imagine, but for centuries, this was the height of professional medical skill. If amputation was the most dramatic surgery, lithotomy was the most dreaded. Lithotomy is the surgical removal of bladder stones. Today, it's minimally invasive. In the Middle Ages, it was the stuff of nightmares. Stones in the bladder were extremely common because many people drank water contaminated with minerals, had poor diets, and lacked modern hydration habits. When the stones got too large, they blocked urination and caused agonizing pain. So surgeons developed a so-called cure. The patient lay on their back. Their legs were held up. And the surgeon made an incision through the perineum, the soft area between the genitals and the anus, to reach the bladder. The area is packed with nerves. Cutting through it was excruciating, but the worst part was retrieving the stone. Surgeons inserted metal tools through the incision, gripped the stone, and dragged it through the narrow opening. Large stones sometimes tore surrounding tissue on the way out. It was brutal, dangerous, and often fatal. And yet, for some patients, it worked. When the stone came out, so did years of pain. Lithotomy became so infamous that some medieval laws banned untrained practitioners from performing it. There were even traveling specialists, known as stonecutters, who performed the operation across Europe. People would save money for years to pay these men, even though the procedure might kill them. That's how desperate life could be before modern medicine. But not every painful procedure involved major surgery. Some of the most common and most agonizing were surprisingly small. Take tooth extraction. In the era before modern dentistry, tooth pain was one of the most universal human experiences. Cavities, infections, and abscesses were incredibly common. And when the pain became unbearable, there was only one solution: pull the tooth out. But dentists weren't always the ones doing the pulling. Sometimes it was barbers, sometimes blacksmiths, sometimes wandering healers at markets. Many used crude metal pliers or forceps. They would grip the tooth brace their knee against the patient's chest and pull as hard as possible. If the tooth broke, which it often did, the extraction became even more painful. The person doing the pulling had to dig deeper and keep twisting until the remaining pieces came out. People described the pain as sharp, shocking, and overwhelming. Some fainted. Others needed to be restrained. And afterward, without antibiotics, the open socket could easily become infected. It's hard to believe, but tooth extraction was so feared that some people endured chronic tooth pain their entire lives rather than face the procedure. Next, let's talk about cauterization. For thousands of years, cauterization, burning tissue with a hot iron, was considered a universal cure. If you had a wound, a rash, an infection, or even a headache, some form of burning was recommended. The logic was simple: fire kills disease. And while that idea wasn't completely wrong, the execution was. A cautery iron was heated until glowing red. Then it was pressed directly onto living flesh. The pain was immediate, intense, and often traumatizing. Patients didn't just feel the burn on the skin, the heat penetrated deeper, sometimes damaging nerves and muscle. The smell of burning tissue was unforgettable. Yet people agreed to it because the alternative, untreated infection, could be worse. What's strange is that cauterization occasionally worked. Burning a wound kills bacteria. It seals blood vessels. It stops bleeding. And in a world before antiseptics and antibiotics, that was sometimes enough to save a life. Still, few medical treatments in history were more feared. But even procedures that didn't seem violent could be dangerous and painful. Bloodletting, for example, was one of the most common medical practices in human history. Doctors believed almost any illness, fever, infection, headache, mental illness, came from bad blood. And the cure was simple: remove it. The doctor made cuts on the patient's arm or leg and let the blood drain into a bowl. Sometimes they removed only a small amount. Other times, so much blood was drained that the patient fainted. In severe cases, bloodletting could cause convulsions or cardiac collapse. Despite how misguided it was, bloodletting was performed for over 2,000 years. It was used on king's soldiers, philosophers, and ordinary people. It was even used on George Washington during his final illness. But bloodletting had a cousin leech therapy. Leeches weren't as painful as other methods. But the sensation of dozens of small creatures sucking blood from your skin was deeply unpleasant. And once a leech latched on it, secreted anticoagulants that caused wounds to bleed for hours afterward. People often left these treatments weak, dizzy, and frightened. Across all these procedures, trephination, amputation, lithotomy, tooth extraction, cauterization, bloodletting, there is one question that naturally comes up. How did people survive any of this? The answer is a combination of biology skill and, surprisingly, luck. Human bodies are incredibly resilient. Ancient and medieval surgeons were often more skilled than we assume, passing techniques down for generations. And although their tools were crude, fire and alcohol accidentally sterilized them more than people realized. But the biggest change came in 1846 with the introduction of surgical anesthesia. Suddenly, pain was no longer an unavoidable part of medicine. Surgeons could take their time. Procedures once done in seconds became meticulous, careful operations. Shortly after that came antiseptic techniques and antibiotics, transforming surgery from a desperate last resort into a reliable science. And because of that, many of the practices once considered normal, burning wounds, sawing through limbs without anesthesia, drilling into skulls, disappeared almost overnight. Today, we live in a world where surgery is safer and less painful than at any point in human history. But it's worth remembering that this progress came at a cost. Countless patients endured unimaginable suffering, and countless surgeons tried, failed, and tried again. Their struggles shaped the medical world we now take for granted. So, when we look back on the most painful medical procedures in history, we're not just observing cruelty. We're seeing determination, a human willingness to face incredible pain for the chance to survive. And even though the methods were primitive and often misguided, they laid the foundation for the knowledge we rely on today. In a way, the story of painful medical procedures is the story of human endurance. It is the story of people willing to suffer so that others someday wouldn't have to. And that journey, painful as it was, is what allowed modern medicine to become what it is now: precise, controlled, and most importantly, humane. That's how the most painful procedures in history shaped the world of healing we know today. What we see today as extreme, brutal, or even unthinkable was once considered ordinary. These procedures, trephination, amputation, lithotomy, cauterization, bloodletting, were not punishments. They were the best attempts people had at survival. They represent a world where pain was unavoidable, and where the courage to endure it was often the difference between life and death. Modern medicine has moved far beyond these methods, but the lessons remain. Progress doesn't happen all at once. It builds slowly, generation by generation, through trial error, and the willingness of people to face the impossible. So the next time you step into a brightly lit clinic or receive a painless treatment, remember that you're benefiting from thousands of years of experimentation, suffering, and persistence. Every comfortable medical experience today stands on the shoulders of those who came before us. Thanks for exploring this journey through history. If you'd like to continue uncovering the strange, surprising, and sometimes uncomfortable ideas behind our modern world, feel free to stay around for more. There's always another story to explain.